Hey there, I am Kendra Perry from kendraperry.net, and in this video, I'm going to teach you how to properly understand page 1 of the GI map. So if you guys want functional health training and you want to learn all the nerdy ins and outs of functional lab testing, plus online marketing strategies specifically for health coaches, make sure to subscribe to my channel and hit the bell when it comes up so that you can be notified every time I post a video on Thursdays. Hey guys, so if you are alarmed or confused by some of the infections that come up on page 1 of the GI map, don't worry, I got you covered, because by the end of this video, I'm going to go through the entire page 1 with you so that you fully understand what to be concerned about and what to forget about altogether. And just so you know, guys, I've looked at hundreds and hundreds of GI map test results in my clients, in the practitioners that I work with. So I know what we're looking at, and I can totally teach you how to understand this. Okay guys, so let's jump right into this. What I'm going to do is I'm going to share my screen so you can see what I'm looking at. So you should see my screen now, and basically what we're looking at is the page 1 of the GI map. Okay, so basically with the page 1, yes, there are a lot of infections on here. I'm referring to those E. coli strains that are a bit alarming, and when you see these, you're like, oh my God, is my client or patient dying? Like, do I need to send them to the hospital? Like, what the F is going on? Okay, so what I'm gonna tell you about these various strains of E. coli, and this also actually includes Salmonella, but basically with the E. coli strains, yes, these can be very pathogenic. Yes, in certain cases, they can make people very, very sick. But typically, if somebody's coming to you and they're not in the hospital with chronic diarrhea, chronic dehydration, and vomiting, then these things are probably just passing through them and are going to be resolved by the immune system, or they're just going to self-resolve on their own. Okay, so your client, maybe in the past few months, might be able to recall a time they had food poisoning, where they may have been exposed to one of these E. coli strains through food or water contamination, or they may not remember this at all. And the truth is, if these things come into the system and they take hold of the system, then your person is going to go to the emergency room because they're going to be very sick. But if that wasn't the case, or it isn't the case, then a lot of these things are self-limiting, meaning that they kind of self-resolve or break down on their own in about a few life cycles. So for the most part, the E. coli strains, I wouldn't even worry about them. And in a lot of cases, you don't even need to address them directly. So I have never, to this day, in hundreds of tests, seen any of these pop up on a retest. Typically, you see them on one test, and then when they pop up on a retest, or when you do the retest, that you don't see them. If they were to pop up, then I might start to worry about them, but that's typically not going to be the case. Okay, so as scary as the E. coli strains are, don't worry about them. Just make sure you're supporting the gut, you're supporting the immune system, and you're dealing with some of the other infections. Okay. So Campylobacter, this is a bacterial infection. It can affect the upper GI, the lower GI. It can cause a lot of toxicity. So with this one, you're going to want to implement a bacterial protocol to address it. I can say that it's one of the more rare infections. I don't actually see it pop up that often, but you definitely will want to address this. The C. difficile. So with the C. difficile, basically what we're looking at are toxins, A and B, from C. difficile. So the GI map doesn't actually directly test for these organisms. It just tests for these various toxins, the A and the B strain, okay, to determine if it's present. So C. diff is a more serious infection. It tends to be very, very resistant to antibiotics. And it doesn't really respond well to antibiotic treatment, even though that is the conventional medical treatment for it. It actually responds much better to a probiotic protocol, which I actually discuss in another video. But you will want to address this. It is a more serious infection. It does tend to be correlated with chronic diarrhea and chronic infections, other infections, and also just chronic GI issues. Typically, it is picked up in the hospital. If people have spent any amount of time in the hospital or they've done antibiotic therapy, then that can be a really good way to get C. diff, because it is one of those very resistant antibiotic strains. It's sort of like a superbug, okay? Okay, so Vibrio cholera, it technically could be cholera, but most strains of the cholera are actually totally non-pathogenic and they don't cause any issues. If your person actually gets cholera, they're going to be in the hospital, they're going to be really sick. So this is another one that you don't really worry about because most of the time it's going to be related to a totally non-pathogenic strain. We don't know what strain it is, but if your person isn't like highly sick in the hospital, hooked up to IVs, then it's not really something you need to worry about or even address directly. You're going to work on the bigger infections that you see later down on the panel. The Yersinia, this is an infection that tends to be associated with hypothyroid and Hashimoto's. Again, I don't see this very often, but you would definitely want to address it in a bacterial protocol, especially if your person does have thyroid issues, okay? Okay, so scrolling down, the next is we look at these parasitic pathogens, and I call these the big bad three. The reason I call these is because these are some of the worst parasites that you can get, notably Entamoeba histolytica. So this is actually the only infection on the entire GI map that you probably are not going to be able to address with a herbal protocol. This parasite tends to leave the GI tract. It goes into the brain, the lungs, the liver. And so it's very, very hard to get rid of, and it does require an antibiotic protocol. So if you're unlicensed, you will be wanting to refer out to a practitioner who's licensed so they can get a proper antibiotic. It's a pretty well-known parasite. It's technically the most dangerous parasite known to man. So most practitioners and doctors are going to be well aware of it, and they should help your client or patient get that antibiotic treatment, okay? Cryptosporidium, basically that name means cell destroying, so it does cause a lot of damage in the GI tract. I've heard that it can actually cause more damage to the lining of the gut than someone with undiagnosed celiac disease. So it is nasty, but it does tend to respond to one round of a parasitic protocol. Giardia, also gnarly, also known as beaver fever. People tend to get it from contaminated water. Again, it typically will respond to one round of parasitic treatment, but something to keep in mind is it does like to travel into the gallbladder. And if it's in the gallbladder, the herbal treatment doesn't really get there. So typically 30 days into the treatment protocol, I'm going to have that person do a series of coffee enemas to help flush the Giardia out of the gallbladder. You're going to want to be doing a lot of bile support to make sure that you actually get rid of it. These viral pathogens, adenovirus, norovirus, they're very common viruses that people pick up. They will stay, if you do get them, they can stay elevated for up to 6 months after infection. So this could be current, it could be a past infection. Your patient or client may remember getting a little sick, getting a virus, getting sick, but typically these things, again, just kind of move through the system. They're self-resolving. The immune system will flush them out at some point. If you were to see these on a retest, I would definitely consider doing a viral protocol, but just for good measure, you may want to add in just a light viral support just to make sure that you're doing something to support the viral pathogens. Okay, guys, so now that you know what's up with page 1 of the GI map and what you should be worrying about versus what you shouldn't be worried about, you might be wondering, well, what about the rest of the test results and the panel? So I actually created a super sweet freebie. It's my GI map cheat sheet for practitioners where I basically go through the entire panel. I give you notes on every infection. I tell you how you should be addressing it. I even tell you certain blood chemistry markers that you can look at to identify if someone might have a GI infection. So if you want to grab that, just click the link below this video. And guys, if you like this video, let me know, send me a comment, share this video, make sure to subscribe to my channel, give me a like. This will help me know that you like this content, that you want more from me, and I will continue to produce videos like this if you're into it. Okay, I hope that was helpful, guys. I'll see you in the next video.